Well, we haven't done this in a while, have we? Which is, in a way, kind of nice since, COVID and more COVID, and we did a lot of COVIDing, but things have kind of eased into cruise control as far as local response. Just about everybody has a pretty good handle on what's going on. So we haven't needed to be quite as active, but there are some things that have accumulated, and so we're going to spend some time going over new things and reviewing other things on today's town meeting program, brought to you as always by Cordova Wireless Communications. They are your local cell phone provider and wireless data provider and talk show provider. Nice to be able to do business with folks who keep the money in town. So on the agenda today, we have a news release that came out yesterday regarding new protocols for COVID-19 on ferries, a recent news release from the state on travelers entering Alaska by land or sea. So we'll read that down. And then we've also got the latest written update from the city with some Q&A and advice from Dr. Zink included in there, how we can help the vulnerable population, some other things like that. So nothing super serious, I don't think, but worth going over. So let's start with this news release that came out yesterday, Sunday, from the Department of Transportation. And the headline is, AMHS announces new protocols to minimize transmission of COVID-19. Not that we've had a ferry in a while, but presumably we'll have them eventually. So these are some things to keep in mind. And so what they say is that the Alaska Marine Highway System has announced new operational protocols to protect against the transmission of COVID-19 on vessels. These protocols include all passengers over the age of 2 on the mainline ferries Ketchikan, Matanuska, and Tustamina are required to provide a negative COVID-19 test within 72 hours before boarding. So it sounds like they're doing similar to what's being required on airplanes. Although it would appear that there is not unlike airplanes, there isn't an option to test after the fact. So that's kind of interesting. Again, all passengers on the Ketchikan, Matanuska, and Tustamina are required to provide a negative COVID-19 test result within 72 hours before boarding. Well, that'll be easy for us to do on the outbound, but you'll want to keep in mind and be sure to get information on your return. For example, will Whittier and or Valdez have the same kind of rapid testing that we do here? And is it free? And how long does it take? So you'll want to know your destination in that regard. So that's the Ketchikan, Matanuska, and Tustamina. It says all passengers on the day vessels Leconte and Lituya must complete a passenger screening form, which is downloadable from the state site, before boarding, and must be able to respond no to all the questions. All passengers boarding in Bellingham, Washington must complete the mandatory State of Alaska Travel Declaration form and provide these to AMHS crew at boarding. AMHS passengers must be able to select number 1A on the declaration form. I don't have the form in front of me. I'm not sure what that is, but the travel declaration form is downloadable. All passengers over the age of 2 and crew are required to wear face coverings while on board mainline vessels Ketchikan, Matanuska, and Tustamina, except when in a stateroom, in a designated smoking area, or while eating. Accommodations will be made for passengers who are unable to wear a face covering due to medical conditions. All passengers over the age of 2 and crew are required to wear face coverings while on board the day vessels LeConte and Latuya, except when in a designated smoking area while eating. Accommodations will be made for passengers unable to wear face covering due to medical conditions, so that's the same. Basically the same rule. I don't know why they didn't just say for all of the above-mentioned vessels. Anyway, passengers and crew will not be allowed to go ashore during port calls. Passengers will be allowed on shore only upon arrival at their destination port. And finally, all passengers and crew will practice social distancing. The news release concludes by saying the safety of passengers and crew is the highest priority for the Alaska Marine Highway System. AMHS continues to work closely with the Department of Health and Social Services to establish protocols intended to protect everyone during sailings, especially sailings that are longer in duration. They then remind folks that there are test site locators for the U.S., and they provide a link to an Alaska test site locator, something that we are doing better than most, if not all, by the way, thanks to our local IMT. I would imagine these links can be found either on the state site. I'm looking at a printed copy of this, and hyperlinks aren't very useful in printer copy, but it shows that they are there. Oh, it also mentions if testing is not available in your location, there are FDA-authorized home tests that may be an option. They talk about the Pixel system from LabCorp and the Everlywell COVID-19 test home collection kit. And then they mention down here at the bottom that the AMHS protocols are available at the AMHS website. So you can probably see this news release and these links by going there. That's dot.alaska.gov and then navigate to the Marine Highway area. I don't imagine it's probably that hard to find. So, some interesting things to keep in mind if and when you plan to use the ferry system and what's expected. Somewhat similar, like we said, to that 72-hour window for flying, except that it doesn't sound like there's an option to even board unless you have your test in hand, for the Kennecott, Matanuska, and Tustamina at least. So the bottom line, know your vessel, know the protocols. More than likely, the AMHS portion of the state website is the place to get that. Again, dot.alaska.gov/AMHS. Now, another news release here that came out from Unified Command regarding travelers entering Alaska by land or sea and the need to complete the travel declaration form, and also the requirement that everybody needs to choose between quarantine and or testing. So this reminder says the state of Alaska requires travelers entering Alaska to follow specific quarantine and or testing procedures identified in Health Mandate 10. COVID-19 screening and testing facilities have been established in 10 Alaska airports that receive out-of-state travelers. Those who arrive in Alaska by land or sea may not be greeted by COVID-19 screening and testing facilities like those established within Alaska's airports, but these travelers are required to provide test result information and a completed travel declaration form in accordance with Health Mandate 10. The travel declaration form and other Mandate 10 information can be found at covid19.alaska.gov. So in essence, even if there isn't somebody at the place you're arriving to tell you, which again Cordova has, and as I understand it, not just at the airport, but there are plans to have that at the ferry terminal as well. But even if a person is coming in somewhere where there aren't obvious people to help, it doesn't excuse you from the mandates. For land borders, as in borders between Alaska and Canada, essentially, in partnership with the state of Alaska, the U.S. Customs and Border Protection is supporting traveler adherence to Mandate 10 through distribution of the mandatory travel declaration form and testing voucher at Beaver Creek, Haines, and Skagway border crossings. The state is in close communication with counterparts in Yukon Territory, Canada, to ensure consistent messaging for travel through Canada. For maritime ports, coastal communities are approaching screening and testing in ways that meet their individual community needs. While some communities are considering mobile screening and collection capabilities, others are working directly with their harbor masters to implement screening processes and inform incoming private vessels of travel mandates and locations of nearest testing sites. Travelers entering Alaska via maritime ports need to check with harbor masters prior to arrival to understand local screening and testing requirements and resources. Unified Command is also coordinating with the Alaska Marine Highway System on traveler education, mandatory travel form distribution, and general travel compliance with Health Mandate 10. For both land and maritime ports of entry, travelers must complete the travel declaration form and may submit a qualifying COVID-19 negative test result when traveling to Alaska. These can be submitted in advance to traveler@alaska.gov, an email address there, traveler@alaska.gov. However, travelers should retain duplicates of both the travel declaration forms and test results for verification purposes to be physically presented at each port of entry screening site. Any traveler who arrives in Alaska by land, sea, or air who cannot take or will not take a COVID-19 test is required to conduct a 14-day quarantine and fill out the traveler declaration form. So while not, I'm sure in some people's mind, an awesome choice has been maintained for those who don't want to submit to a test. You don't have to do that. You just have to choose to quarantine instead. Because actually, I don't think that, if I remember right, I don't think that the government can compel testing. But you know, the last time I thought about that was weeks ago, and who knows? Because 2020 is the year of confusion. So let's turn our attention to information released by Cordova. Of course, you probably remember from last week that we had a second positive result found in screening. It was somebody, it says the individual is an Ocean Beauty employee that had been in quarantine since arriving in Cordova and was asymptomatic. All contacts from the quarantine bubble had been tested and were negative. Now, this is as of last week. I haven't talked to anybody about this yet today. If there are any developments, we'll certainly cover them in the briefing. But the IMT is usually really good about notifying me if they were to discover another positive case, because transparency with all of us has been a very high priority to them, and we're part of that. So this goes on to say the individuals and additional contacts are being identified and tracing, and any that are found will be tested and quarantined per state guidelines. The Cordova Medical Response Team has confirmed that the screening process is working and identifying cases early. As more information becomes available, the Medical Response Team will inform the city's incident command as appropriate. And that's what, when we talked to Mayor Copeland and Dr. Sanders last week about this, it was a very different response if you heard the briefing about it than that first one. Which obviously the first one is a smack upside the head, but the second one, actually, everybody on the front line of response seemed to just sort of take it in stride. They were like, yeah, we know this is likely to happen, and the system is working exactly the way that it's designed. So for the time being, of course, we can feel pretty good about it. Now, not so much so in Ketchikan, and this was a head slapper when I read about this last week, and the city is mentioning it too. In their release here, they say a new COVID-19 case in Ketchikan triggered a broad investigation after local authorities say a traveler with the virus ignored quarantine, potentially infecting many others in the Inside Passage community of about 8,500 people. Ketchikan emergency officials issued a statement last Wednesday notifying the community the person was waiting for results from airport testing June 13th and was instructed to quarantine until those results came in. Instead, officials say they attended several social gatherings and public places, attended by many young people, families, and locals on Saturday, Sunday, and Monday before their positive test result came Tuesday. The release says because this individual did not quarantine after arrival to Ketchikan as directed, there is a potential of wide community spread of COVID-19. The effects of the social gatherings are far-reaching, and there has been a broad ripple effect to many citizens and organizations. It wasn't immediately clear if the person was a resident or from outside Alaska. The state confirmed positive cases in both types of people in Ketchikan on Tuesday. Nicely done! You know, I dug around a little bit in some Ketchikan social media and got the impression that this was a teenager who, because of the teenage brain that says, nothing bad's going to happen to me, I'm invincible. Not to mention the, sort of primal desire to place partying over whatever else. Anyway, I don't know the particulars, but the point is, it's a good example of the chaos that's created when people just flagrantly defy what the response people say should be done. Because even if it doesn't result in an outbreak, and of course we pray that it doesn't, but what happens is then a lot of resources have to be expended with this contact tracing. If a person tests positive, if a person gets a test and then goes into quarantine and the test comes back positive, there's a much more limited amount of contact tracing that has to be done because that person hasn't been around, breathing around or touching or whatever very many other people. But when you do like Doofus did here, got the test, was told to quarantine until the test result came in, said, nah, not going to do that, went out and partied a bunch of places. Well, now there are dozens of people that were, incidental contact, direct contact, people that the kid knew or didn't know or whatever, and now everybody's got to be traced and tested, and it's just, there's a term for it that I can't use on the radio, but you kind of get the idea, which is why it's nice that it appears, at least from what I'm hearing from our frontline people, that we aren't seeing much of that. Now, other folks anecdotally, may have different stories to tell, but it really makes it better in terms of not having to take up a bunch of energy from the people responsible for doing the tracing, local and state folks. They have to divert now a whole bunch of resources to Ketchikan that could have been used in other places, paying attention more to the state overall because of one knucklehead. So may Cordova be as knucklehead-free as possible. Next in the city release, a reminder that with COVID-19 cases on the rise, there is the hope that all Alaskans are carefully considering whether or not to host or attend social gatherings. They understand the need everybody has to see friends and family, but they continue to urge keeping social circles small and provide some information on how to consider your risks and gather cautiously. They then have a quick Q&A section, which we'll run down here since we're doing very well on time. Question, is there testing at the airport 7 days a week? Answer, airport testing is Thursday, Friday, Saturday, Sunday, and Monday, 5 days a week. Testing is available at CCMC or Alanka Monday through Friday. So that combined schedule should accommodate travelers arriving from out of state such that a prolonged testing delay is avoided. So on the days, in other words, they've arranged the schedule so there are some days that testing is available at both the airport and the clinics. There are a couple of days where it's only the clinics, a couple of days where it's only the airport. But our IMT has made sure that every day there is somewhere at least to be able to get one of these tests. Question: are travel declaration forms with testing information being collected in Cordova? Answer: no. Travel declaration forms with the testing information provided by travelers need to be sent to traveler@alaska.gov. Cordova's ambassadors are not collecting the forms. They do, however, have the forms available. Question: if an arriving traveler from out of state has not been tested, are they immediately sent to quarantine? Answer: quarantine is required until receipt of a negative test result. So you only need to quarantine for as long as it takes for them to let you know that you're okay. And if you're not okay, then again, you've been isolated from as many other people as possible. That's the theory. And it'll be easier to get you the care you need while not exposing others. Question: do out-of-state travelers without tests have to get tested right away? The answer: arriving travelers from out of state must get tested within 72 hours. As a side note, right away would be better for the benefit of the traveler and the community. So the sooner the better would be awesome. And any traveler coming in from out of state that hasn't been tested really probably should quarantine until they're able to get tested and get the negative result. Next question: may an out-of-state traveler choose 14-day quarantine instead of taking a test? Answer: travelers arriving from out of state must quarantine for 14 days if they opt out of testing or test positive. So that seems like a little bit of a veering away from answering the question, but the answer is yes. A traveler can choose quarantine instead of testing. And then the final question: is anyone following up on whatever a traveler chooses to do? The answer to that is the state is relying on individual compliance, and how the state is following up is at present unclear, which has been a theme since things started kind of opening back up again. There were a lot of voices saying, not all, but a significant number saying, let's rely on the good sense of the population to self-police, essentially. Now, I don't know how much of that good sense is being applied. I talked to a friend who went to a memorial service yesterday, actually, and said that probably 90% of the people were wearing masks, but in this indoor facility, we're not social distancing. We're still shaking hands, and I mean, and I know different people have different views on that, but that does seem to go counter to a lot of the advice. So you hope, I guess, that the people that get sick from that are people that consciously chose to accept the risk, and that, people who are trying to do the right thing in terms of following the medical advice aren't adversely impacted by that. The latest from Dr. Zink here, saying why she wears her mask. Reason number 1, humility. I don't know if I have COVID, as it is clear that people can spread the disease before they have symptoms. Reason number 2, kindness. I don't know if the person I am near has a kid battling cancer or cares for their elderly mom. Where I might be fine, they might not. And then number 3, community. I want my community to thrive, for businesses to stay open, employees to stay healthy, and keeping a lid on COVID helps us all. So Dr. Zink's 3 reasons as reported by the city: humility, kindness, and community. The city goes on to remind us about the assets available for locals to get COVID-19 information. The webpage, covid19.cityofcordova.net. There is the Cordova Prepared Facebook page. You can still email questions to cordovaprepared@yahoo.com. You can call the community update line at 424-WELL, which has recorded information. And then they are continuing to maintain 424-INFO, where you can get a lot of different information. Dedicated phone line, manned by knowledgeable staff to take questions. You can get phone numbers for local assistance groups, information on state financial and food assistance, information on Cordova health mandates, Cordova's phase of the state reopening process, information on forms and information on forms and information, that's nice. Information and forms, details on those provided by the city and the chamber, details on when and where to get tested, and then a place where you can voice questions and concerns and hopefully get answers about the city's response. The next section in here is a reminder that during this time, it's important we look out for and be helpful to the people in the vulnerable population. If you know someone with heart, kidney, or lung issues, or is 60 years of age or older, or has a compromised immune system, please reach out to offer your support. Together, we can keep our whole community safe and healthy. Ways to support them would be shopping for them or delivering groceries, checking their email, lending a hand with household cleaning, assisting with household chores, make sure they have a mask or face covering, keep them updated on COVID-19 information, and take the time to check on them as a caregiver or friend. On the next page here, and I think this is really creative, they provide a reminder that there are some assets available for helping kids to understand and not be scared and open up about this. This infographic says it can be hard to know how to talk with kids about the virus, and they often need to hear information repeated over and over. So there are some e-books gathered by Emory University that can help tell the story. And then they list a number of them here. And I think you can find access to the titles on the Cordova Prepared website, covid19.cityofcordova.net. But if you're curious about the titles, there's one called We're Going to Be Okay. It's got a kid with a mask on the front. What Color Is Today? Has a little dog by some paint cans. COVID-19 Helpers, another one with a kid that has a mask. And then another one called Together, Living Life During COVID-19. Now, I don't know. I have to confess, I didn't have time to look up if these are downloadable ebooks or something that you would order and pay for or what the deal is. But I would go to the City of Cordova webpage and try and find the information. And it says they're ebooks. But there again, I don't know if they're free or if you pay for them, but that's a great idea by some children's authors. There's a reminder in this packet about the Bob Corn Pool being back open for lap swimming. That started last Tuesday, I think. We talked about this in detail in one of the daily briefings, and if you want to know how it works, you have to have an appointment. You can't just walk in. Call 7282 to figure out how to pay your fees and take advantage of that and the other procedures that are involved. But there is lap swimming at the pool. You just have to have an appointment and follow some procedures. 7282 to get details. Or again, all of the details, I imagine, are on the city website, covid19.cityofcordova.net. This is probably on the Cordova Prepared page as well. We'll give you a quick reminder, too, that the Salvation Army assistance is out there. Funds for those who've become unemployed or laid off or furloughed or had a loss of income due to COVID-19. They're helping out with gap amounts necessary to pay bills. So if you need rental assistance or utility assistance, Jenny Ragland is ready to take your call at 907-339-3440, 907-339-3440. And that's that. Our town meeting program for June the 22nd. Not too intense, hopefully informative. If you need to hear it again, if you joined us late, if you want to listen to it more slowly at your own pace and take notes or pass the information on, especially, I guess, if you have anybody planning to come up from the lower 48 on the ferry, or anyone you know is planning to take the ferry to here from somewhere else, in-state or out-of-state, you can direct them to this program on the YouTube channel if they like listening, or direct them to the state website, the ferry section, for being able to see this stuff in print. But this show will go up on the YouTube channel, youtube.com/CordovaTV, as soon as Robbie can get it up there after I, zip it and get done. Thanks to Cordova Wireless Communications for sponsoring the Town Meeting Talk Show on KLAM. Very valuable operation here, not only because of keeping our dollars in town so they circulate 5 or 7 times, however many times it is, but also all of the dollars, millions of them, literally millions of dollars that Cordova Wireless and CTC bring into the community from outside through the various subsidies and other benefits provided to co-ops that also then get plugged into our economy and circulate here. It's a big deal. Helps a lot. We thank them for their support of local radio. We thank you for listening, whether you're hearing us on the radio or at youtube.com/CordovaTV. For those of you listening to the radio, we will make sure you don't miss any of the 10 a.m. programming that you are entitled to hear, the various features and bits of information. And a final reminder, this is an on-demand program, so anytime you think we need to do a show on something, would like us to pursue a guest, or if you would like to have us read an opinion of yours or whatever, we're always happy to make the time. We don't just sit here for the sake of sitting here every day, but when there's something to talk about, we absolutely will. And it will, and those ideas can come from you. So, hope everybody had a great Father's Day yesterday. Have a great Monday today. And we'll see you next time on Town Meeting.